I think it's important to address skin thickness with patients because absolutely it can change the possible outcomes, it can change your timeline. And so it's important to discuss with your physician a realistic outcome. If you think about a thin covering, let's say you've got the analogy of silk sheet covering a trophy on the bed, right? Well, you can tell that's probably a trophy underneath there. You throw a comforter on it, it's just a bump now, right? And so the amount of detail you can see is less with thick skin than with thin skin. And so there are different techniques to try to minimize that, but there's always going to be less of a quote unquote sculpted appearance, but almost always you can get a significant improvement. But to get to that final result, it definitely is going to be a little bit longer. Usually that's a year, but sometimes that's even better at 2 and 3 years, quite frankly. Whether that's 75% done in a year, 85% done in a year, 95% done in a year, it really depends on the person. And there are some things you can do both technically during surgery as well as post-operatively with your salt intake, etc., minimizing exercise, heavy lifting, etc., for a longer period that can help with that. But yes, that absolutely has to be part of the discussion with patients, especially with thicker skin.